The Melbury Clinic VeinCare Centre receives inquiries from our website as a result of our informational open events, personal recommendations from previous patients, and from social media sites such as YouTube and Facebook. As a result of inquiries, clients may receive our information pack or our newsletter. In addition to people who self-refer, we also receive referrals from general practitioners, other doctors and healthcare professionals. The Melbury Clinic VeinCare Centre has an excellent reputation with local healthcare providers. Furthermore, our YouTube channel has more subscribers and visits than any other UK-based channel dedicated to venous disease, and our internet presence is designed to provide the public and healthcare providers with information and educational resources rather than to be purely promotional. After an initial inquiry, either by telephone, email, letter or via our website contact form, patients are then seen for a consultation and duplex ultrasound scan. At this appointment with the vein specialist, a full medical history is taken, the patient is examined clinically, and both legs are examined by colour duplex ultrasound. Based on this initial assessment, the patient will receive a full discussion of the vein abnormality, and there will follow an explanation of all the available treatment options in line with current national guidance. The patient will subsequently receive a full written report. If appropriate, treatment by endothermal ablation will be scheduled at a time convenient for the patient. The treatment is performed under local anaesthesia as a walk-in, walk-out procedure. Thereafter, treatment is followed by at least 2 scheduled follow-up appointments 2 months and 6 months after treatment, which include a duplex ultrasound scan of all the treated veins. Successful treatment is judged clinically and by duplex ultrasound. Additional treatment, if required, is scheduled, and if not required, the patient is invited to take part in our annual vein check program. This annual vein check program, abbreviated to AVC, recognizes that some patients have an hereditary predisposition to vein recurrence, and so by annual attendance for assessment by duplex ultrasound, early varicose vein formation and superficial venous reflux recurrence can be abolished before deterioration and before the development of complications such as varicose eczema, phlebitis and ulceration. As far as we know, the AVC is a service that is unique to the Melbury Clinic VeinCare Centre. If enrolled into the AVC, patients are seen yearly, and if the patient declines, the treatment is complete and the patient is discharged. If the patient has any cause for concern within 12 months of treatment, additional appointments are offered. At every stage, the fees are made clear before intervention. Patients with private medical insurance are offered assistance with their claim, and our fees are published on our website. The safety of our patients as they journey through this clinical pathway is at the centre of our policies and procedures. For example, before a patient is booked for a consultation, our administrative staff complete a checklist of suitability. Patients with a significant medical history may not be suitable for treatment in our facility. So, for example, we do not treat patients with a history of heart rhythm disturbance, severe angina, or patients with a pacemaker. This is entirely for reasons of safety. In addition, we believe that it is difficult to treat and follow up patients who live a very long distance away. We receive inquiries from many people in the London area, for example, and for patient safety, we often recommend referral to a phlebology colleague in London. In keeping with guidance from the General Medical Council, we believe that sharing information between specialist and GP is an important part of patient safety. We explain this to all patients who self-refer. we seek their permission to send their GP details of their consultation and permission to request information from their GP. We have specific consent forms to record their permission. All correspondence from the clinic is also sent to the patient. The duplex ultrasound scan is performed with the patient standing, and a very small minority of patients feel faint during the scan examination. For safety, we have a nurse present who can recognize any signs that the patient is feeling dizzy or faint and who acts as a chaperone during the examination. For safeguarding, we have a chaperone policy for the conduct of the examination and a chaperone checklist to record important aspects of the chaperone event. To protect patients from infection, our examinations are conducted by staff wearing aprons and gloves. Staff hand washing is performed in line with our protocols, and our ultrasound transducers are covered with disposable covers, and the ultrasound probes are cleaned thoroughly between patients. Many clinicians think that these measures are excessive and unnecessary, but we believe they are important demonstrations of our commitment to infection control. Prior to treatment, all patients receive advice about their available treatment options in line with NICE guideline CG 168. They are consented in line with recent changes in the law, which emphasizes patient-centered information. Treatment during pregnancy is avoided in line with NICE guidance NG 45. Patients are assessed for risk of DVT in line with NICE clinical guideline CG 92, and all of these safety steps are recorded in a systematic and consistent manner in our documentation. Patients are given a comprehensive information sheet about their procedure prior to treatment, and they receive a pre-assessment telephone call from our nurse before treatment. In our treatment room, when conducting the vein procedures, all the instruments are sterile, single-use and disposable. The electrical equipment is safety tested regularly. Medicines administered are checked and recorded by 2 members of staff. The WHO checklist procedure is followed, and Sharps handling procedures are followed to reduce the risk of needle stick injuries. Emergency drugs and resuscitation defibrillator are available, and all our staff are trained to immediate life support standard, ILS Resuscitation Council UK. During the endothermal ablation procedure, patients are monitored by ECG, blood pressure, pulse, and oximetry. Many clinics that offer vein treatments under local anaesthetic do not offer continuous monitoring of these vital signs, but we believe they are an important aspect of patient safety. Patient comfort is also monitored by a pain score assessment. Patients leave with a written aftercare advice sheet, and a day or 2 later they receive a telephone call from our nurse to assess their progress. Information on our post-procedure advice sheet is reinforced during the telephone call, and any issues that may have arisen are addressed. Key information from this telephone call is recorded in a systematic manner. The effectiveness of our treatments is reviewed against nationally published guidance such as the NICE Quality Standard QS 67 and the Royal College of Surgeons Vein Commissioning Guide. The effectiveness of our vein clinic is reviewed and published monthly in our Quality Assurance Report, which forms part of our governance process. We seek feedback from staff and patients, and we use this feedback to improve our service. Feedback is published widely on our website, which also explains what we do with this feedback and how we modify what we do. We aim to be a responsive organisation. The clinical pathway for endothermal ablation is available on our website, and the link is provided below. The clinical pathway provides clarity on how we manage patients suitable for treatment by endothermal ablation, and it demonstrates how we strive to be a safe, effective and responsive organisation. The clinical pathway informs the daily practice at the Melbury Clinic VeinCare Centre. It underpins the conduct of consultations and interventional procedures. Safety is embedded into our organisation and into our clinical pathway. This chart shows how the clinical pathway provides clear evidence of safe practices. Our staff are carefully recruited by interview to ensure that they are suitable for their role in our organisation. The interviews are standardised and references are always taken up. All staff are checked by the Disclosure and Barring Service, DBS, and once appointed they have continuous training, professional development, they receive appropriate supervision, and they are regularly appraised. Our staff are encouraged to be members of an appropriate professional body. Through regular meetings, our staff are involved in the planning and delivery of our clinical pathway. We have a zero tolerance for infections. Our infection control measures include a daily cleaning schedule against a checklist and a twice-yearly deep cleaning schedule. We constantly monitor for infection incidents, and these are reported monthly. We have commissioned an external review of our infection control measures to assess our performance. Our Medical Advisory Committee is independent of the clinic management and it provides oversight of clinical activities. It scrutinises applications for practice privileges, approves applications for the introduction of new treatments, it reviews incidents, complaints and near misses, and it advises the clinic management on appropriate actions. It also reviews the monthly quality assurance reports from the clinic manager. The equipment and premises are kept in good order through regular maintenance, service contracts, and portable appliance testing, PAT inspection. There are regular visual inspections of the premises and equipment, and staff are encouraged to report any issues through daily checklist filing. Staff receive appropriate mandatory training and life support training to deal with emergencies. Before treatments are carried out, our automated external defibrillator, AED, and emergency drugs are checked and made ready. Our instruments are all single-use, and safe practice is ensured by our SHARPS policy, Safe Medicines Management policy, laser safety training, and our WHO surgery checklist, and by the use of procedure documents for standardised safe practice. During the interventions carried out at our clinic, patients are continuously monitored by ECG, blood pressure and pulse oximetry. During 2017, our management of medicines has been reviewed by an independent consultant. A medicine management report has been produced and actions taken. Fire safety at the clinic has also been reviewed and, as a result, our fire alert system has been completely upgraded. Fire safety checks form part of the daily staff checklist. There is weekly fire detector testing and fire evacuations are regularly rehearsed. Medicine management, fire safety and infection control have all been independently assessed in 2017. Safety is the responsibility of everyone at the Melbury Clinic. During the course of each day, as the patient travels through the clinical pathway and as staff complete checklists and documentation, everyone is encouraged to report any concerns or incidents to the manager. The manager has a regular presence, receives all the checklists and takes part in regular walkarounds looking for safety issues. As a result of these activities, the manager produces reports on audits and collates the daily reports into a monthly quality assurance report, which is published widely and which is discussed at the Medical Advisory Committee meetings. The Melbury Clinic Limited understands the importance of maintaining all major services for the safe conduct of its work. To this end, the clinic has taken steps to ensure that equipment and services are kept in good order and that suppliers of utilities are in place and charges for utilities are paid in a timely manner. Nevertheless, failure of major plant or service may arise outside the clinic's control. The clinic has a comprehensive business continuity plan which ensures the safety of all our patients should such problems arise. This continuity plan forms part of our new staff induction program and it is rehearsed regularly. Safety is at the heart of all our activities. It is embedded in our clinical pathways and it is monitored through a rigorous system of reporting and monitoring. The leadership of the organisation is committed to safety and has made it the responsibility of everyone in our organisation.